when COVID hit and quarantines kind of came into lockdown, we just saw all the businesses just shut down, and people couldn't go to work, and there was a big need to bring people safely back. And so we looked at what people were doing, and there was a lot of just unsurety, is that a word? Unsureness of people just bringing people back in and doing what they could to get them back in, but it may not be the safest way. And so we just saw a bunch of problems that we felt like we could solve with getting people back into the workplace safely. Well, really, it is a healthcare product, but it's something that you use daily. So it's really about the interaction between people and the app and making it simple and making it easy. And so we focused on that when we built it. So our goal was really to get it to something that would be 30 seconds at the most, and something that you could do from home, so that you weren't creating this like log jam when people are getting to work. If you think about an office building, it could easily have 200-300 people on a floor, and if you've ever been to Disneyland, you see a line of 300 people is not something that goes quickly. So trying to do that every day, we wanted to help people avoid that. So we wanted them to be able to do it quickly and easily and from home, and then bring the verification piece into it. In our methodology, we have a selfie is taken and a timestamp along with your health reading, so you have more of a verified status compared to a lot of other people and things they were doing out there, which is just you take your own temperature and freely write down what your temperature might be and submit that. Yeah, so from an employee side, you don't necessarily want your employer to have access to your health data. That's personal, private data. And so our system actually has a break between you get to capture your data, and we compare your health data on a daily basis with your company's standard. And so your data stays private, but your company gets to see if you meet the standard or not. Yeah, so from the employer side, there's even more really benefits. So first is you don't want to manage your employees' health data if that's not what you do. It's actually a big task, and there's a lot of liability that goes along with it. So having VitaCorpo take care of the management of the protected, HIPAA-protected health data of all your employees just takes a huge burden off of you as an employer. Secondly, it's operationally efficient, so you're allowing people to do this at home and quickly get into work, because as the federal government has stated, all the time that employees have to spend extra getting into work based on COVID precautions, all that is paid work. So that's a cost directly saved by the employer. Yeah, and so doing it from home allows the employer to see whether they meet the standards earlier or at the earliest possible moment. So instead of your employee showing up at 8:30 for an 8:30 shift and finding out that you have to turn him away and you lose his productivity for the day, you find out at 7 o'clock when he's just getting ready for work, and that you can adjust accordingly to cover his shift and get him to the doctor as soon as possible if that's what your process allows for. What a lot of people are doing is bringing everyone in and then putting them in a line, and then having a security person or even a healthcare person stand in line and take everyone's temperature. And the fact that you've already got everyone together, and then finding out who has symptoms, you've kind of already lost the battle, because every time you find someone that actually has the symptoms, you've actually already exposed them to your whole staff. So when someone is identified as having of breaking your workplace standards and saying that they're not qualified for work, that's also usually the standard that people are using to send people on quarantine for 2 weeks. There's a huge cost to that. So by using VitaCorpo to identify these people that need to be tested, get them tested, verified, and make sure that they are good and safe to come back to work and get back to work as fast as possible, that's a huge cost savings. By using VitaCorpo as a methodology to identify the people that would go on quarantine and to be send them out immediately for testing to figure out if they actually need to be quarantined, and using it as a tool to test daily to see as soon as you can get them back to work, your business is going to be able to lessen the expense of paying paid quarantine leave for your employees that are flagged as possibly having symptoms. We combine 2 types of health readings along with a survey, so the first being temperature and the second being blood oxygenation, which is a translation of lung function, which is one of the leading indicators for COVID. And so it's going to allow you to identify a percentage of your employees that may have symptoms earlier than if you were doing temperature alone. The first thing that stands out is the verification piece. The fact that we're taking the selfie alongside of the temperature and oxygenation reading, it allows you to get to know whose reading that you're actually receiving as a corporation or a business, rather than just a free field text where anyone could enter whatever they feel like, whether they actually took their temperature or not.